Good evening. Thank you for joining us. My name is Sarah Zenaida Gould, and I'm the Executive Director of the Mexican American Civil Rights Institute. Welcome to tonight's conversation about epidemics, public health, and Mexican Americans. Before I introduce tonight's special guest, I want to thank tonight's MACRI Talk sponsor, AARP Texas, whose mission is to empower people to choose how they live as they age. Thank you, AARP Texas. Now I would like to introduce Dr. Ana Martinez-Catsam, Professor of History at the University of Texas Permian Basin in Odessa, Texas. She specializes in the history of the Gilded Age and Progressive Era in Texas with an emphasis on epidemics, newspapers, and the Mexican American experience. Tonight, she will walk us through a history of pandemics spanning more than a century into the past, as well as the current pandemic we're still living through today. So welcome.
Thank you. Thank you for having me.
Yes, of course. So here we are in the second year of the COVID-19 pandemic, but this is not our first major public health challenge. What should we know about this epidemic that happened over a century ago, the yellow fever epidemic?
First of all, the history of epidemics. In the history of epidemics, the Mexican American experience, the Mexican American voice is missing. So let me explain. We as historians can explore the conditions. We find examples of some personal experiences from a small group of Mexican Americans, usually elites, and we can build the narrative. But the general voice for the community was never recorded. And so as I work on epidemics such as the yellow fever epidemic of 1903, since my specialization is Gilded Age Progressive Era, finding the Mexican American voice or the personal experiences is difficult. So historians, we create the narrative and we build using various documents. My work is in San Antonio with the yellow fever epidemic. And in San Antonio, the focus of this epidemic isn't the cases. It isn't whether the Mexican American community is affected or the Black community. It's the quarantine. And the focus becomes a debate over the quarantine the state quarantine that's imposed on San Antonio. Now, to give some background, yellow fever cases start to emerge in the ports in Mexico. And then these ports came and people started to expand. And cases then, yellow fever, then spread across the border. And Laredo was severely hit. The Mexican community in Laredo, the Mexican American community, was severely hit. There were definite cases there. Now, starting with Laredo, the Mexican American community was referred to as ignorant, as superstitious, and because of the expanding cases. And we have the state health official, Dr. George Trabar, who would refer to the community as, and there's a quote when he's talking to the papers, and he refers to them as the Mexicans were adverse to taking treatment from educated, experienced professionals or physicians and preferring the old methods practiced by Mexicans of the lower class. So what you start to see in reference to the Mexican American community during 1903 is this perception that they're ignorant, that because, or their refusal, their superstition, the refusal to accept the advice and the practices of, and again, they emphasize educated Americans, then you have the spread. Well, in Laredo, it's pretty bad. And they try different techniques. Now, how does it affect San Antonio? Well, San Antonio, and this takes place the summer into early fall. In October, San Antonio's holding a fair. They have an annual fair. It's the International Exposition Fair. And it's a big deal because in San Antonio, you have the rise of the tourism industry. And this fair brings in hundreds of individuals from across the state, from Mexico, from surrounding states. And so there's a cleanup campaign. As soon as there are cases in Laredo, officials in San Antonio decide cleanup campaign. So residents are told, if you have water barrels, oil them and then cover them with netting to prevent mosquitoes, because that's how yellow fever is transmitted. Clean up weeds. It's all about cleanup. And San Antonio portrays itself as the cleanest, healthiest city in Texas at this time. It has a reputation as a health seekers resort because of the hot well springs and the climate. So what happens is the fair's going on. There are yellow fever cases in Laredo. So San Antonio officials place a local quarantine on Laredo, and to prevent individuals from Laredo from getting off trains or moving into San Antonio, to prevent the spread of yellow fever. What happens is that suddenly there's a report that there's a yellow fever case in San Antonio. And then the rumors start to circulate that there are yellow fever cases. So the state health officer is going to advise the governor to place a quarantine, which they do, but only on San Antonio, which is going to affect the festival, the fair. It's going to affect business. People can't go in or come out. So you have this quarantine. And so the entire time in San Antonio in 1903 is not whether there's yellow fever, it's the quarantine, the debate for the quarantine. The health board in San Antonio and other local physicians argue there are no yellow fever cases. It's been mistaken. The state argues there are. So it's that debate. Now, where you see the Mexican-American experience, again, it's very limited. It's often in reference to, an individual who passed and whether or not they passed from yellow fever. But that's the extent. So the voice isn't there. And so what we're seeing in 1903 are just the general perceptions of how the Mexican community is portrayed as, again, superstitious, as ignorant. But the voice of the Mexican American people just isn't there. At that point, nobody thought of recording and archiving. And when we're looking at the community, you're looking at a community that's majority lower class, living in poverty. So, and whether it's written diaries or letters, they're just not there. So we can put together the narrative, we can build it, but the voice isn't there. So when we're looking at 1903, again, we can't look at it from the perspective of today. There is a period, and we're seeing it in 1903, of these racial perceptions and how a community is portrayed, and it's from the Anglo view. So we have, again, building that narrative takes time, but it does teach us. And with each epidemic, these early epidemics, we learn lessons. And for the Mexican American community, hopefully today, is this lesson of preserve, so that we can include the voice. Now, of course, as you had mentioned, this is not the first. Now, 1903, the yellow fever epidemic was not the first that affected, the nation, that affected Texas or San Antonio. It's one of the first ones at the turn of the century. It's not even the first yellow fever outbreak. You have one in 1901. So you have outbreaks, but this was considered an epidemic, not a pandemic, an epidemic.
Yeah. For those of us who are watching and are pretty unfamiliar with yellow fever, can you just tell us what exactly happens when you get this? So you mentioned that it comes from mosquitoes. But
Yes.
do you die? What happens?
You can. So depending on your health conditions, the fevers are in there. You do have some internal issues. So yes, you can pass away. You can die from yellow fever.
Okay. And then you mentioned that we don't really have a sense of how the Mexican American community felt about yellow fever, but in the Anglo or mainstream world, they were describing Mexican Americans as, I guess, spreaders of this disease because of following superstitious practices, or and even being unclean. Because you mentioned that there were concerns about having clean water, keeping the yards clean to keep the mosquitoes away.
Yeah,
So,
there's this idea that
stereotypes.
yeah, absolutely, of cleanliness, an emphasis on cleanliness, and they are these stereotypes, and there is some resistance in the Mexican community. And so what we see in 1903 is these perceptions that they're not going to the doctor, they're not seeking the advice or following the advice of the physicians or the health agencies at that point, because they're scared that Americans are trying to kill them. Which again, this is the perception of from some Anglo health authorities, saying, "Oh, they're not coming; they're refusing." One, because they're ignorant of the ways. They're superstitious and hold on to, what they consider their lower class methods of dealing with health, which was often home remedies.
Yeah, folk medicine, right?
Absolutely. And so, and then what you see in the paper as well are mentions of, well, they're not doing this because they're afraid that, Americans are trying to kill them. So they're not taking the medicine or they're not following the rules. So it's this concept of they're, again, the community is ignorant. And there's an emphasis of the community, the working class, the poor, which are the majority, are ignorant. So there's a resistance by them to embrace, these new techniques, to embrace American medicine.
Shall I put up this image that you have
Oh yes,
from the?
please.
Yes. Okay. Let me put this up, and then maybe you can tell us about this.
Okay, so what we have, these are images from the San Antonio paper. And in the images, now if you see the political cartoon, what happens in San Antonio is San Antonio is going to be divided. You have those individuals that argue that the yellow fever cases that have been identified are not yellow fever. They've been misdiagnosed. And so they challenge these local authorities, including medical authorities, challenge the state authorities on this. Now in San Antonio, you're going to have two newspapers, the Light and the Express, and one's a Republican paper, one's a Democratic paper. And during during the yellow fever outbreak, you're going to have the papers divided. You have the Express, which often considered referred to as the lady by the Light, as the paper that says go along with it. Follow the advice. Accept the quarantine. And then you have the Light, and this is an image from the Light that's leading the way. It's one of the most vocal critics of the quarantine, and that's fighting the quarantine. That's arguing, these are wild rumors. They're hurting San Antonio. Businesses are suffering. And so what you have here is once you have the lifting of the quarantine, this is an image from the Light, and the lady, again referring to the Express News, is being fumigated. And you have on the other side, you have some of the sections from the Light talking about how these are rumors and how citizens need to stand their ground. And they hold this protest. They call a gathering where you do see health officials who stand up and say there's no yellow fever, local health officials. So you have this organized protest with the idea of challenging the quarantine because it is bad for San Antonio. And so they challenged the diagnosis.
Um, one of our viewers, Chui, he writes. Let me see if I can show this on the screen. He writes, "It seems the perception of Mexican Americans as spreaders falls in line with stereotypes perpetuated by the eugenics movement, and where they argued that Mexican Americans were disease carriers." And this also, I suspect he might also be alluding to this. I just am thinking of the bath riots in El Paso
Mm-hmm.
when Mexican day laborers were being fumigated, much like in that political cartoon you showed us. Is there a connection?
Oh, absolutely. This is definitely the period of eugenics, the belief that in the oh, it looks like we might be getting a storm. Where you get this perception. Oh, it looks like we are getting a storm. So if it gets a little dark, let me know. I'll turn on the light. You do have this perception that immigrants, that minorities, that different ethnic groups are inferior. So we do see that. So absolutely, this is a time where eugenics is used to justify immigration policy, restrictions.
Yeah, yeah. Wow. Okay. Um, and the other thing that strikes me about what you showed us from the light and is that okay, 1903. That is about 10 years before what would become known as one of the most important Spanish language papers, not only in San Antonio but in the U.S. La Prensa. So 10 years later, there was more of an opportunity, I guess, for Mexican Americans to present their side of things in the written word in a way that now historians can look back at that. But in 1903, there were some Spanish language papers, but not as robust,
Mhm.
not with as widespread distribution at that point. Yeah. Okay. Well, okay. So in terms of yellow fever, that kind of comes and goes, and then just a few years later is probably the most famous epidemic of the 20th century, the so-called Spanish flu. So, how did the Spanish flu or the 1918 flu epidemic compare with that earlier yellow fever epidemic?
Well, in 1918, the influenza is a pandemic
Okay.
because it's a pandemic, so it's going to affect the world. And it's actually this is also the time that that we have World War I, and so influenza kills more individuals uh, globally than the war did. So it is devastating. Now, can you pull up the
Yes.
next image? Okay, so these are images from the press on the Spanish influenza, and so in my work, again, I look at San Antonio. I've looked at El Paso with this. What I'm seeing is again, if especially if we're talking about today's pandemic, the current pandemic, is that you have some of the same processes. So once you have Texas is affected by the influenza outbreak in the fall, which is considered the second wave. So in the fall of 1918, you start to see cases in Texas. So it spreads southwest, and it will continue to spread. So you're going to see communities who are going to take action. So you have public places that are closed, schools are closed, theaters, similar to what you see today. Now, what's going to differ, because you had mentioned La Prensa. Surprisingly, during the Spanish influenza, La Prensa focused more on what was going on with the influenza in San Antonio or Texas. So at this point, it's still very much an exile paper, but we do see coverage. Now in San Antonio, and part of it's the war effort as well, trying to downplay the influenza outbreak, the pandemic. But in San Antonio, there isn't much of, again, the Mexican American voice or the Mexican American experience in some of the written records. Now, you have some that you might find in archives, but they're not many. And again, they're not going to reflect the vast majority of the population, which, again, are the poor. What is common in, for example, San Antonio and El Paso is that the barrios, these neighborhoods, they lack the infrastructure that the Anglo neighborhoods have. And we're talking medical facilities, updated sanitation and road systems. So when influenza hits and it spreads, it's very devastating. Now, we see more of a focus on the Mexican community in El Paso because it was devastating. And so we see more of that reporting. But again, it's from the Anglo perspective. In the slide, you see the paper, the picture of the Ayori school. Okay, that's in El Paso. And what happens is because of the lack of medical facilities in the Mexican American community and the outbreak that happened there, the school was turned into a temporary hospital. And I actually want to read, again, talking about how the perception of the Mexican American community is from the Anglo view. So I'm gonna kind of read and I just want to emphasize some of the language used. And what you're seeing here is the description of the poverty, but also how the Mexican American community is described. So we have here we go. So there is an article when the school's first transformed into an emergency hospital. So it starts off with a description, and it talks about how brought in from the squalor of homes in the Mexican quarter of town, many of them in the last stages of pneumonia. See, pneumonia was a deadly effect of influenza. All of them suffering from lack of proper medical attention and comforts. The patients were transferred from the depths of poverty to the comparative comfort and care of a hospital equal to, in almost every way, to any in the city. And what that emphasizes is the fact that you don't have these hospitals in the Mexican quarter. And the emphasis of the poverty, that exist in the barrios. But when referring to these individuals to Mexican Americans, in some of the descriptions, they talk about skin color. There's an emphasis. In one section, they're talking about, they're describing some of the patients that are being brought in. And they refer to, let's see, here lay a grizzled Mexican tossing from side to side, his body in constant motion as he groaned for breath. Beside him on the next cot lay a small babe, hardly more than 2 months old, its brown hands, and notice the description, its brown hands clenched on the coverlet, its tiny black head motionless upon the pillow. So you start to see these descriptions. And again, and it's from the perception of the Anglo journalists, from the Anglo volunteers. And then I have another, because again, what I'm finding is that even when talking about or referring to the Mexican community and how it's affected, there's an emphasis on the Anglo presence in the Iori school. It starts off with, and women were very active in volunteering and assisting. And what I have noticed going through the papers is that white women Anglo women are emphasized by name. And there are many names in there. On occasion, you might have the mention of a Mexican woman. And when they're talking about the community members who donate or provide assistance, they mention specific Anglo businesses by name, but they don't really do that with Mexican businesses. So, and I do want to kind of read this out. So again, the skin color. 9 little brown-eyed babies are being cared by Miss Margaret Stevens at the Iowa School Emergency Hospital. So again, it's that description of skin tone, and then the mention of the Anglo volunteer who oversees them. Those women who have been working in the kitchen have innovated a Mexican gruel, atole, which has made a decided hit with the patients. It was suggested by one of the Mexican women who has been helping in making soup. So again, there isn't a name attached to the Mexican female. And as the article continues talking about the women who volunteer and the businesses who are assisting, they have one Mexican woman from down the valley furnished 1.5 gallons of fresh milk each day. So again, it's a nameless individual. But at the same time, in just a few lines later, it's talking about Miss Elizabeth Stevens has given jams and jellies. And then Miss James Dick, Miss James Brown, Miss James Lackland Brown. And so you can tell they're related. Have made sandwiches. You have another Miss Lane is another matron who's furnishing soup. And so there's a difference in how the press, and again, this is an Anglo press, how the press portrays the community. Even at this time of a pandemic, it's about, in this case, females who volunteer, but there's an emphasis on the Anglo females who volunteer. Yeah, and again, there are, in all these articles, there's a listing of names. And yes, on occasion, you do see some Spanish surnames in there, but they're not many. Oftentimes, it's a reference to a Mexican woman or a Mexican man or a Mexican business. But again, they're nameless. So what the 1918 pandemic, especially when we're talking about the Mexican American experience or the Mexican American voice, shows is that even at that time, again, we're looking 15 years later from the 1903 outbreak, the voice is not there. Now, with La Prensa, again, La Prensa, still pretty much an exile paper that does focus more on what's going on in Mexico. You do see, a Mexican voice in there, but it's more about Mexico more so than Texas or San Antonio.
I see. I do have a question related to that. So by 1918, there are a handful of active mutual aid societies serving Mexican Americans, mutualistas, in San Antonio, across the Southwest, quite frankly. One of the things that the mutual aid societies are well known for in that period is paying for the funeral expenses if you have an unexpected death, like from the flu. Have you been able to find any evidence of the mutual aid societies being activated by the Spanish flu?
The mutual aid societies do provide assistance, but they were affected by, again, the war, because this is also a time of the Liberty Loan Drive. So they were affected by that, and they're also dealing with an increased demand for assistance. And this is a time where the casualties list, those who are passing from influenza starts to grow. That in some places, you don't have enough caskets to bury. So there is some assistance, but there's more demand than there's resource available.
Wow. In a way that it makes me think of unfortunately, in the early days of the current pandemic, of these horrible images that we saw of hospitals that had like refrigerated trucks outside because of this um, number of deaths that were just overwhelming to the hospitals.
Now, in some communities, the the civic authorities, would, especially for the poor who couldn't afford a casket, they would encourage lumber companies to provide lumber, again, at either a reduced cost or free, because it's devastating. I mean, the pandemic's devastating. You have, we as you go through the paper, there are death notices, so we can track that way. Uh, you have some extended ones that are very descriptive of who the individual was, but it depends on who the individual was. Was it a leader in the community? Oftentimes, the death notices for the poor is simply a reference that they passed. So it's hard to get that voice, that the voice of the community when the records just aren't there. And with the pandemic, 1918, unlike the pandemic today, where you have all this technology, you don't have it then. And it's one of those things that oftentimes with Spanish influenza, it's lost from memory. So it's very individualized. And stories that might have been passed down from, generations, they get lost too. If they're not maintained or preserved, they get lost. So along the way, the memory of the Spanish influenza kind of takes a backseat to the war. And it is devastating. So what type of long-term impact did it have? We're not quite sure, because here's where we need, again, that personal experience, that voice to come in. We can trace from death records and hospital records, we can trace some possible impact. But again, the personal experience, the voice, it's lacking.
Yeah. So we don't have a real sense of how many Mexican Americans were lost in the 1918 pandemic from the flu. We just know there were a lot.
And here's the thing about 1918 influenza outbreak. Influenza at that point was not a reportable disease. So even with the numbers, and it's because of the pandemic that reporting starts. And even then, there are questions of, are physicians accurately identifying? And there are, scholars have questions of misdiagnosis. You have individuals who passed and were never treated. So the numbers are estimates. And if you do have members of the Mexican American community who didn't go to a physician, who passed, unless they do autopsies, we might not have known if it was as a result of influenza/pneumonia, because pneumonia was the deadly complication.
Mm-hmm. Mm-hmm. Yeah, and I would suspect that if you were a poor Mexican American, nobody was doing that autopsy on you after you died.
Not the way you would expect it, especially because of the pressure. You have businesses that are closed. You have this economic pressure. You have this health emergency. And doctors were getting sick, nurses were getting sick. There's a call for volunteers, so everyone's affected.
Mm-hmm. Mm-hmm. Do you have any sense of how information about how to keep yourself protected may have been communicated to the Spanish-speaking population?
They use the Spanish language press.
Okay.
So the bulletins, the health bulletins from the federal doors, the PHS or local, it was through the press. You have them. La prensa does carry some of those translated. Through local physicians, through the health authorities. The Red Cross also provided these flyers So they relied in 1918, you don't have the centralized hub like the CDC where you can go online. So they relied on the press. They relied on organizations such as the Red Cross to get the word out, to provide the pamphlets. They relied on the local health officials. And we also have to remember, this is before television, this is before radio became, before radio. So newspapers were essential, an essential way to get information out.
Yeah, and I guess one thing that I find concerning about that, and I mean, it is what it is because at the time, you're right, the radio wasn't part of regular life at that point, and there was no TV, obviously. But I just think about what I know about literacy rates at that point. So um, it's possible that there wasn't as much information as needed to be. I know there are stories about in downtown San Antonio, in the Mexican part of downtown, there would be people who would read the paper out loud. So perhaps that was also one way.
Yeah.
But if people were trying to not be in large gatherings, that might also be a challenge. Yeah. Okay. Well. Okay. So okay. That's the big famous sort of 20th century pandemic, and then of course when COVID-19 hit, I think for a lot of people it was such a shock that there was this global pandemic, and many of us needed to be reminded. Well, in fact, your grandparents may have experienced this, your great grandparents may have experienced this with the 1918 flu pandemic. So, why is it, again, can you just remind us why we don't remember that as well as we should? Why were we so shocked when COVID-19 hit?
With Spanish influenza, it was competing with the war. So the focus was the war, and in the press, there's an attempt to downplay in some areas because, again, this is going on at the same time that you have the Fourth Liberty Loan campaign, and the need to keep the war momentum going. So there's this competition with the war. So the war eclipses the pandemic, and then what starts to happen is that whether it's again part of the devastation of the memory, because you have you have orphans as a result of the pandemic. You have families that and it spreads through the family, where if let's say the husband gets it, then the children, the wife, anyone living in the home will also get that. And you have accounts where entire families pass away. So there's that pain of the memory. And so it gets, for the pandemic, the memory's more individualized than, again, this public memory. Mm-hmm. But those records, if there are letters that reference the influenza or the impact, diaries, oftentimes those don't make it into an archive. Assuming individuals were, again, writing letters and keeping diaries, that voice is not preserved. And if there is that oral tradition of talking about what took place, over time, through the generations, that gets lost as well. I'm teaching a Texas history class this summer, and I was also doing a Spanish influenza class, a research class, and I had students, when we were talking about this, said, "Well, my great grandmother used to talk about, her brother passing from, the flu. It would have been around this time, but after that, she really didn't want to talk about it because it was too painful to remember." And so you have that going on as well. So it suddenly, and you're right, when COVID hit, suddenly influenza. I was called to talk about a comparison between influenza and COVID. And suddenly influenza was reemerged in the public memory. But that's the thing, it was buried. And so there's still a lot of work that needs to be done exploring the 1918 pandemic.
Okay, so one of the threads we've seen throughout this yellow fever's history, as well as the 1918 flu pandemic history, is that there's very little to document officially the Mexican American experience through those health challenges. So, as we have been experienced now in the second year of COVID-19, what are ways that you've been seeing the Mexican American experience documented?
And one thing I say a lesson. And can you bring up the next slide?
Yes.
Thank you. So one of the lessons that I see is we need to preserve. We need to preserve, the Mexican American voice. We need to preserve our memory of the pandemic, which is still going on. I've seen more coverage in whether it's on the digital platform or in print, newspapers that talk about or have interviewed Mexican Americans. So that's being preserved that way. But also with the current technology available with social media, during lockdown, during the quarantines, people could still communicate. Cell phones made it so easy. 1918, there were telephones, but again, that can't be recorded. But during the pandemic of 1918, you needed a phone operator to make the connection. And so operators were suffering from influenza. And because of the increased use of telephone lines, authorities were asking individuals not to use the telephone unless it was an emergency, unless it was related, calling a physician, unless it was an emergency. So it impacts. But today, you have the cell phone, so people could still be somewhat connected, although it's not the same as in person. Social media postings, Facebook, Instagram. Again, you have so many different. These are ways to document. I also see since 2020, books by the fall of 2020, there were publications by early 2021. There were publications of the experiences of nurses being published, or works that talked about women, mothers, and how they dealt with homeschooling now and the lockdown. So you have this pandemic is somewhat being documented. Now, what we need to do as a community is preserve these, because a social media post can be deleted. So we need to preserve them. Some university libraries and I know that some public libraries, such as the one in Austin, they have these COVID-19 projects. And on the slide, the COVID-19 file. So this is a project where individuals could submit photographs that they've taken, diaries, writings. They can put an essay, poetry, pictures of. Here you see the artwork they can submit, and this is one way to preserve. Now, not all communities are doing this. Some universities are doing it to preserve the experiences of their students and faculty and staff, but some have opened it up to the community. I would strongly encourage individuals to share their experiences, because this is one way we can document, make sure that the Mexican American community, when 30 years from now, even 10 years from now, when historical work is being done on COVID, that voice is there. It's the way we can trace not only short-term impact but long-term impact. So we need that voice preserved. And so I encourage everyone, you know, if you took photos, look and see if in your community you have an institution that has a COVID-19 project. So again, and this, as someone who, excuse me, my kitty likes to be part of the conversation. Um, what this does, it makes sure that we as a people, as a community, are represented.
Yeah, that's wonderful. That's wonderful. I put the links to that Austin project in the chat for people if they want to look at it. There's one link where you can see other people's stories, and one link where you can ask to submit your own story. So those are there for you. Um, and I just wanted to add that I think, at least I'm under the perception that in this current pandemic, there were people demanding that cities, counties, the feds keep track of numbers so that we would have a sense of how is this impacting Latinos, African Americans, Asians, etc. Um, and perhaps that pressure to document in that, at least statistics of infection and death and that sort of thing, were not being broken down by racial or ethnic groups maybe in the past.
Hmm. Yes. So, because again, today's society is very different from 1918. We do have the breakdowns. I mean, the CDC, for example, provides the breakdowns, even by state. So there are medical institutions that also do the same thing. So we have more of a record. We can look at, because I did the piece for the Texas Almanac on COVID-19. So we can look at the political orders, basically the governor's orders. We can trace the actions of civic government. We can look at, because of the press and social media, we can look at responses.
Yeah,
That helps build that narrative, but we still need that personal experience.
absolutely. So what I think is so critical that you're pointing out is we might have some statistics, but it's not the same as a personal reflection on here's how this impacted me, my family, my community. So
And,
having
and,
the
and you're right, and you need both when you're looking at building when we're looking at the history. You need both to build a narrative. Uh, we can provide the orders, we can provide the numbers, but we need to give that a face. We need to see how's this, you know, affecting the working poor. Are the shutdowns? How is the spread affecting the working poor? Not only immediately but long term. And we can look at all the communities, because we are a very diverse community, and
right.
so we need all those voices.
Right. And I will just say, just earlier this week, I think it was, Unidos US released a study on COVID 19's impact on Latino children's educational outcomes. And unfortunately, they did find that during particularly that whole school year where students were more or less learning from home, in particular, uh, their math scores for Latino students went down a
Mhm.
lot. Um, and so it's going to be a bit of a rebuilding period for those kids. And we want to make sure that they're able to get back on par with the rest of their classmates.
Oh,
So,
oh, absolutely, absolutely. It's, and again, and there are studies that are being done, but again, since we're still in, we're still going through the pandemic. Again, the different stages of the pandemic, we're still going through the pandemic. We can see some immediate. We can even look at. I'll call it. It's not long term, because yes, we've been 2 years now, so we can look at some of that. But then there's real long term. For example, those of us who, and I got COVID. The household here got COVID. Um, how does that affect our health long term? They're looking at, because of what it does to the lungs, how's that going to affect long term? So there's still so much that we need to look at. So all this documentation is important.
I do want to share, we have a comment here from Dr. Hector Gonzalez, who's based in San Antonio, and he says, in COVID, Mexican Americans kept the country going at the risk of getting sick. They increased communication among each other, supported each other, and helped community-wide, feeding others in the barrio. I think that's an experience that a lot of people have witnessed.
Oh, absolutely. And those types of experiences are also important because you do have individuals who came together to, again, assist the community. So those have to be documented as well. How did the community, let's say 20 years from now, I'm doing research on COVID in San Antonio. How did the Mexican American community, how did the barrio respond to the shutdowns? How, the impact, how did they come together? How did they, again, you have that personal voice and you need all of them. And knowing that, yeah, COVID in some ways, and part of it is because of the technologies, kept the community together. But again, you start to see the mental health impact that COVID's had. You mentioned the impact on education, and we're looking at all levels of education up to the university. How has that changed for Mexican American businesses? How are they bouncing back from COVID? Are they? So all of that are items that we need to explore. All of that is history. We just have to document it.
Okay. Well, I think that's a good plug for everybody watching to think about recording your family's experience of COVID. How did you get through? That would include your losses and your wins during this difficult time. And let's see if we can find some ways to get those stories shared, because you're right. Historians in the future are going to want to know, and your grandchildren, your great grandchildren, they're going to say, "What do you mean there was a pandemic?" Yes, there was a pandemic, and somehow we got through it. I hope it's not over. But I want to thank you, Dr. Martinez-Catsam. This was really informative, and I look forward to seeing what comes next in your research on this. And of course, I want to thank everybody who tuned in tonight. If you like tonight's presentation, I encourage you to learn more about MACRI. Visit our website, somosmacri.org. You can sign up to subscribe to our newsletter. You can follow us on our various social media channels. We need your support. We're building the nation's first museum dedicated to Mexican American civil rights history. So please follow us, like us, that sort of thing. And I'd also want to invite you next week. On Monday, we will be joined by Selena Moreno, and she's the executive director of IDRA, but she's also a former director of litigation at MALDEF, the Mexican American Legal Defense and Education Fund. She's going to be giving us a presentation on the landmark civil rights court case Plyler v. Doe, which is turning 40 years old this year. This is the Supreme Court case that established that all American children, regardless of citizenship, may attend public schools. And it also laid the groundwork for the Deferred Action for Childhood Arrivals, or DACA program. There's a lot going on with that right now, so we want to make sure our community stays informed about what's going on. So thank you again for joining us tonight. Thank you for your time and expertise, Dr. Martinez-Catsam. It was a pleasure to have you with us.
Well, thank you very much.
We hope to see you again, and have a great night.
You too.